Let's talk about our deep hip flexors and deep hip rotators, specifically on the front side. We have two major muscles, which is what we call your psoas muscle, which actually starts from the base of your spine, wraps forward, and actually attaches to the front side of your hip. And then you also have your iliacus muscle, where if I were to find my belly button, here's my hip bone, it's going to be a little bit more so in the middle as compared to the hip bone itself. And they have three major responsibilities. Responsibility number one is going to be actually focusing on actually tilting your pelvis forward or also arching your back, actively flexing your hip, and actually based on the geographical location, we're also looking at what we call internal rotation of the hip. And when you are having issues with your hip flexors, which can often be due to the fact that you're either arching way too much or you're sitting for a long period of time, what ends up happening is that you can get stuck or spend too much time in specific positions. And as we know, spending too much time in a specific position is going to cause some sort of dysfunction. And so rather than saying one position is bad and the other isn't, we're looking at just making sure of being able to provide what we call a novel stimulus. And oftentimes, a way you can address your hip flexors is actually by foam rolling your quads, going from the top half of your thigh and down. There's another video for that. But what if we need to go a little bit deeper? And signs that would actually indicate that you would benefit from going a little bit deeper would be if you have a little bit more buttock pain, maybe a little bit of anterior hip or maybe hip crease irritation as well. And that in itself indicates that there is a little bit of a dysfunction. And this is a technique that can actually be very, very helpful. So what we're going to try to do is actually manually address these deep hip muscles. And the key is focusing on the aspect of here we have the crease of our hip, and we're going to move just slightly inwards. And the best way that we can actually address this is actually by laying on our back. So what I'm going to be doing is I'm going to be laying on my back with my knees bent. What this does, it actually slacks up the entire system. I'm actually going to take my three fingers, my ring, my middle, and my pointer, and I'm going to use the middle as the main pressure point. I'm going to lift my shirt and I'm going to find that hip bone. What we call it is called the ASIS, anterior suprailiac spine. You're going to put your hand on top of that ridge and you are going to move just slightly inward. And the idea is that I'm not just going inwards this way, I'm trying to wrap my fingers around that bone. So I'm not just pushing down, I'm wrapping my fingers around. So I'm gonna find my bone, I'm gonna move inwards, and I'm gonna take my hand and I'm gonna curl my fingers. And what I'm doing is I'm actually pressing on the iliacus muscle, which is on the inner edge of my hip bone. And what you should be feeling, and especially if this is going to be one side versus the other, is that you might feel a little bit of tension, and that's okay. We're not pushing down into the floor, we're kind of finding that ridge and we're wrapping it around. And what you're going to do is once you find that tender spot, we're just going to hang out there for about 30 seconds. And at this point, what you should be focusing on is breathing gently, breathing a full breath, but you're not tensing up your abs. You'll notice if you tense up your abs, your fingers will lift off, and that kind of defeats the purpose. And so another visual representation of what it's going to be looking like is here is my hip bone. I'm going to be taking my hands and I'm going to be wrapping it. And so I'm pretty much having the bone in between my hands and I'm pressing on that muscle. What you're going to do is you're going to find those tender spots and then you're just going to apply a little pressure. You're going to go a couple deep breaths for 30 seconds and then try it on both sides and see how it feels, and you'll stand up. There are a lot of different tools that are out there that actually allows you to get deep, but rather than having to spend a bunch of money, it's a great way for you to do it yourself.